Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Nocturnal enuresis, treatment of nocturnal enuresis. So we have two types of treatment, that is first line treatment of nocturnal enuresis and second line treatment of nocturnal enuresis. First line treatment is mainly given by behavioral therapy is present. In the behavioral therapy, we should reduce the water intake at the bedtime, and we can advise the child to go through pelvic floor exercises, and clock method can also be done. Whereas second line drugs for nocturnal enuresis, are drug of choice of nocturnal enuresis is desmopressin. This desmopressin is an intranasal or oral drug. Then we have another drug is imipramine. Imipramine is a tricyclic antidepressant which is a second line drug for nocturnal enuresis, and oxybutynin is also a second line drug for nocturnal enuresis. The drug of choice is intranasal desmopressin. Imipramine can also be used for nocturnal enuresis because of its anticholinergic properties.
thank you and thank you for watching.